Good evening, everyone, and welcome. I'm Jackie Coogan. I sit on the Massachusetts Parent Teachers Association Board of Directors, and I'm the chairperson of Health, Safety, and Wellness Committee. Before we begin, I would like to explain the logistics of tonight's webinar. All audio and video of participants will be muted. During the program itself, you will only be visible seeing the panel participants as they speak. You may ask questions and answer with the Q&A button at the bottom of the screen. Only in the Q&A button. This is where you will type in your questions. There will be a Q&A session at the end of the presentation for about 15 to 20 minutes. All questions will be fielded from the Q&A box and asked on your behalf by President Madison Estes and past President and Chair of Bylaws, Stephanie Gray. You may use the chat button at the bottom to chat, most importantly, to tell us if you're having any technical issues. You may also chat with each other attendees if you'd like to. However, all questions should be typed in the Q&A box. They are the questions that will be fielded first. If we will try to answer all questions, but in case we go over time, we will have a fact sheet with the unasked questions and answers, along with the recording of the webinar on the Massachusetts PTA website. And speaking of recording, I want all participants to know that this webinar is being recorded. This webinar will also be available on the PTA website in about 5 to 7 days. At the end of this, before you click off and leave, be sure you have received our survey poll. Please take a minute to fill that out for us. We want to hear from all of you, and we learn from everything that you tell us. To be sure that you know and understand, this webinar will be recorded and on our website within about a week. So let's start. We're ready to start our program. In about 2 minutes. I'm waiting now for people to come in. Hello, everybody, and greetings. We have about 2 minutes more. Remember, if you want to write a question in, you do it in the Q&A. If you're having technical problems, you put it in the chat. Welcome, everybody. I am so happy that you are joining us for this evening's webinar, Building Vaccine Confidence to Ensure Optimal Health for Your Child and Family. The Massachusetts PTA believes that all Massachusetts children and families should be safe and live in an environment that promotes health, well-being, confidence, and security. It is because of this belief and mission that we bring this program to you this evening. Immunization and vaccines are truly the answers, especially in this troublesome and devastating pandemic. This COVID-19 is a catastrophe. We know that COVID and all serious communicable diseases are truly overcome by vaccines and immunizations. We have a long history, over a century old in this country, of this knowledge, actions, and advocacy. We must educate ourselves on assuring that our children and families reach a secure and healthy environment in life again. We must advocate to end these problems. We have just the people for you tonight here with us on this webinar to educate and help us learn how to advocate about all of this. Thank you. I am Jackie Coogan. Before we start our program, I would like to thank and introduce to you our new president of Massachusetts PTA, Madison Estes.
Hi, everyone, and thank you so much, Jackie and team, for putting on this fabulous webinar. And we thank all of you for taking time out of your crazy busy schedules to be here with us. So if you would like to know anything more about Massachusetts PTA, the Health Committee, or other committees we have, please reach out to us either on our website or through info@masspta.org, and we will get your questions to the right people. Thank you, Jackie.
Thank you, Madison. It's so nice to always have you here with us. We are really thrilled to have this panel with us tonight. They are such experts in their field, coming together to collaborate with us, the Massachusetts PTA. It is my privilege and honor to be the chairperson of the Mass PTA Health, Safety, and Wellness. Tonight, I'm going to introduce you first to the panelist, to the panel moderator, and that is Cynthia McReynolds. She then will introduce you to the panelists, and then we'll get going. Remember, if you have questions and answers, please put them in the Q&A, and we will certainly try to get to all of them by the end of the program. If not, we will send out a fact sheet with answers. Cynthia McReynolds, Program Manager of the MCAAP Immunization Initiative. Welcome and thank you so much for being with us.
Thanks so much, Jackie, and thanks to Massachusetts PTA and also to the Mass PTA Health, Safety and Wellness Committee for inviting us to speak about something about which we feel really passionate. So we're going to start off by a presentation from Dr. Rick Moriarty. Dr. Moriarty is a professor of clinical pediatrics at UMass Medical School and also a member of the MCAAP Immunization Initiative. So I'll stop sharing now so that you can start. Welcome, Rick. I'll reintroduce David, but Rick will be followed by David Martin, who's Chief Executive Officer of the Massachusetts Health Council. So welcome, Rick, welcome, David, and we're really interested in hearing your presentations tonight.
Thank you very much, Cynthia. Can you hear me okay?
Yes, we can. Go ahead, Rick.
Oh,
Thanks.
okay. I want to talk about immunizations in general and then some specifics about the COVID vaccines that we're all hearing so much about on the news recently. This is a picture of me and my sister when I was in kindergarten. At that point, there were very few immunizations that we had. This is an immunization, a copy of my immunization record that my mother sent me when I was in medical school. And as you can see, there was just DPT vaccine and smallpox vaccine, basically. So we didn't have virtually any of the other vaccines. And my mother recorded that I had measles in 1952 and German measles in 1951 and chickenpox in 1953. So my first couple of years in school were I spent with a lot of illness. Before vaccines came along for most of these diseases, there were some major health problems in the United States. Diphtheria in 1921 killed more than 15,000 people until the vaccine came along. Polio, which was rampant when I was a little boy, 21,000 paralyzed and 3,100 kids died every year from polio until that vaccine came along in 1955. Measles used to regularly kill 500 kids a year before the vaccine came along. Rubella was the cause of many spontaneous abortions, many infant deaths, and many children who were severely crippled by congenital rubella syndrome. When I was an intern and resident, and after I had finished my pediatric training, we had a lot of disease from what's called Hib, Haemophilus influenza type B, that affected 1 out of every 200 children less than age 5. And it caused meningitis, blood infections, very bad cellulitis, many other things until that vaccine came along. Chickenpox, we think of as a benign disease, but there were 100 kids every year who died from chickenpox and some 10,000 who were hospitalized because of complications. And we know that people who get chickenpox have a 30% chance of getting shingles later on in life. We know that rotavirus caused a lot of ER visits and sick children with very bad diarrhea until that vaccine came along. And now we're seeing that HPV, which is a cause of cervical cancers and other cancers, that now has a vaccine that's available for it. And many doctors who are going through their training now have not had the opportunity to see some of these diseases, and that's good and bad. Since vaccines came along, smallpox has been eradicated from the earth. Polio is near to being eradicated. Rubella and congenital rubella are something that we hardly ever see in the United States anymore. Invasive Hib disease, the cellulitis, the meningitis, other infections from that, we rarely see anymore. Chickenpox is much less common, except there are outbreaks of it in groups where people are unimmunized. And we're seeing already that this is having an impact in that shingles is less common now in people who have gotten the chickenpox vaccine. We know that pneumococcal pneumonia is less common in kids. And one of the benefits of this vaccine has been that adults who are around children who have been immunized with PCV13, adults are less likely to get sick too because the kids are not spreading it. We know that rotavirus is less common, many fewer hospitalizations now, both in children and adults. And Australia, which was the first country to roll out HPV vaccine widely to kids, they've seen a dramatic fall in cervical precancers and cervical cancers, and they're actually looking at seeing the elimination of cervical cancer over our lifetime. We know that children are getting more vaccines today. This is the number of the diseases that we immunize children against now. But we also know these vaccines are better and safer and more efficient now. 7 diseases in 1980 used to take 15,000 antigens to immunize kids against. Now we're protecting against more than twice as many diseases with a tiny fraction of the antigens that we used to have in vaccines. So our vaccines are better and safer and protect us from many more things. When people decide about developing vaccines, they look at what diseases are affecting people and how common these diseases are and what kind of problems that the diseases cause and what ages do these diseases occur. And then they have to figure out ways of detecting the disease and detecting immunity. They usually test the vaccines in animals before they try people. And it is not always successful trying to develop a vaccine. Many people have tried for different diseases and not been successful. And there aren't too many pharmaceutical companies who are heavily invested in vaccines. because they can easily earn more money for drugs for cancer, for immunotherapy, for cholesterol lowering, and even for things like Viagra. Could a vaccine be improved is something that people always are thinking about, and we've seen that over the last 30 or 40 years too. This is a complicated slide, and I'd like to walk you through it here about how are vaccines approved. The companies decide that they're going to make a vaccine. Usually before even phase 1 starts, they've been testing in animals to see if the vaccine is theoretically possible and does it help in animals. In the first phase, they look at a very few healthy volunteers to see is the vaccine safe and does it stimulate a good immune response. This phase alone usually costs millions of dollars. When phase 2 comes along, they open this up to more volunteers, usually hundreds of volunteers. And again, they're looking for most common short-term side effects. And again, is the vaccine safe and does it work? This phase usually costs tens of millions of dollars. And then they move on to phase 3 if this works. And this phase usually involves thousands of volunteers and costs hundreds of millions of dollars. And again, how do people who get the vaccine compare to those who don't get the vaccine? Is it safe? Is it effective? What are the most common side effects? And all the while that these phases are going on, there's a data safety and monitoring board overseeing every single person who's involved in those studies. And those people have the power to stop the study if there are abnormal or concerning side effects that are reported. Once these 3 phases go on, the companies present the data to the Food and Drug Administration. The Food and Drug Administration can decide whether or not to license the vaccine. In this case, because of the pandemic, the COVID vaccines have not been licensed. They have been approved for emergency use authorization. After the vaccine usually is licensed, though, the companies then have to start manufacturing the vaccine. And the Food and Drug Administration controls every step of that manufacturing process. Again, the most important aspect of these studies is the safety and efficacy that the phase 3 trials will demonstrate. And when the FDA looks at this information, they have to make sure that there were appropriate subjects in the trial. And in the case of the COVID vaccines, are healthcare workers included? Are the elderly included? Are people in nursing homes included? Children we know are not included in the initial studies with the COVID vaccines. And those who are medically at risk have been included to some degree too. So this is what happens with the FDA's part of the vaccine. Once the FDA has licensed a vaccine, I just wanted to tell you a couple of things about Operation Warp Speed. One of the things that people have been concerned about is that things were, quote, rushed because of the COVID pandemic. Operation Warp Speed gave money to the pharmaceutical companies so they could do phase 1 and phase 2 and phase 3 all at the same time. And as phase 1 and 2 looked promising, they could then start to manufacture the vaccine before it was licensed. This saved literally years of time in vaccine development. So no corners were cut with this. This timeline was changed because the government put the money for development of these vaccines up front. After the FDA has been involved with this, any immunization that's discussed goes to the Advisory Committee on Immunization Practices. This is a whole extra layer of safety that other drugs don't have. Immunizations do. This is a committee that looks at the data again. There are different people from the FDA, different people from the Centers for Disease Control, and they look specifically How safe was the vaccine at certain ages? How does the vaccine work at different ages? How serious is the disease? And is this vaccine worth adding to the routine schedule? If the advisory committee recommends it, this vaccine would be added to the routine schedule of pediatric vaccines. And then after the vaccine is approved by the FDA and added to the routine schedule, there are several safety monitoring programs that are set up to make sure that there are no rare adverse effects. One, the vaccine adverse event reporting system is a sentinel system where people or physicians, anybody who's involved with the patient, can report a side effect that they might be concerned about. There are big programs. One is called the Vaccine Safety Data Link that looks at literally hundreds of thousands of medical records across the country. Harvard Pilgrim is part of that here in our area. There's a different one called Clinical Immunization Safety Assessment Program. Again, hundreds of thousands of records that these people look at, monitoring for potential rare side effects from vaccines. And then with the COVID vaccines, because this has had an expedited approval, there is an additional safety method that Centers for Disease Control added called vSafe. And when you get a vaccine, when you get one of the COVID vaccines, you are asked to register with your cell phone to look at this QR code. It will set you up and will ask you every day and then every week for a period of time if you have had any specific reactions to the COVID vaccines. So there's another way of collecting data about this. How is the vaccine schedule developed is a question that we commonly hear. Well, vaccines are developed to prevent illnesses. And one of the things that we know is in order to prevent an illness, you have to give the vaccine before the disease is likely to happen or before the disease is known to cause problems. And we want to make sure that any vaccine that is added to the schedule, again, is safe and cost effective. We know that pertussis or whooping cough causes severe problems from kids less than 6 months up to age 12 months is when it's the worst disease. So that vaccine is started fairly early in life. We know that pneumonia and Hib vaccine and rotavirus causes severe problems in kids under age 2. So those vaccines are started early in life. We know that measles and chickenpox are usually not a problem until the kids get to be about 1 year of age or older. And that's because they get antibodies from their mother that protect them for a number of months after they're born. We know that hepatitis B, if an infant gets infected as a newborn, there's a 90% chance that that infant will become a chronic carrier of hepatitis B and have long-term liver disease literally for the rest of their life. And that's why we want to immunize kids very early against hepatitis B. The vaccine studies are set up when a new vaccine is added for pediatric patients. It's tested in conjunction with the current schedule of vaccines to make sure that a new vaccine doesn't interfere with developing immunity for the previous vaccines and that there's no increased risk of side effects. We know that a number of studies in the past have been placebo-controlled study. When polio vaccine was developed during 1954, there were 400,000 people across the country, kids who received the vaccine, 200,000 who received the placebo, and 1.2 million who were observed controls, who didn't get either the saline or the vaccine. This study proved beyond a shadow of a doubt that the polio vaccine was effective and it was going to be approved. Denmark did a study several years ago where they looked at autism being caused by MMR in kids who had the MMR vaccine versus kids who did not. And they found that there was absolutely no difference in the rate of autism in kids who had MMR vaccine versus the kids who didn't. We know that some vaccines are required for school. And people say, well, why are there some vaccines and not others that are required? And most of these historically have been diseases that are passed by close contact. We know that whooping cough and diphtheria and pertussis can be transmitted by respiratory droplets. Measles, mumps, and rubella can be transmitted by respiratory droplets. Chickenpox can be transmitted that way or by contact. Polio can be transmitted by hand-to-hand contact, or for diapered toddlers, it can be transmitted in the stool too. So these are part of the reasons why some of these vaccines are required for school. In Massachusetts, we do a darn good job of immunizing kids, and our rates of immunizations for kindergartners for all of these diseases are some of the nation's highest immunization rates. There are only a few across the state exemptions. However, we're finding out that there are pockets of areas in our state where the exemption rates are much higher and not as many kids are protected from the diseases. We see, if you look at the different percentages of kids who are not immunized, we see across the state there are a number of kindergartens and a number of 7th graders where there are much higher rates of exemptions. And when we looked at data from a couple of years ago, we found that more than 40 kindergarten classes across the Commonwealth did not have enough immunization to protect from outbreaks of measles. We know during the pandemic that immunization rates have fallen. These reflect orders of vaccines across the country. And we know during COVID, once the pandemic really hit in early March, the number of people going in for routine visits and the number of kids getting their routine shots fell. There was some pickup toward the end of May, but as we had another peak in the fall, the immunization rates are still low. Unimmunized communities are setups for potential outbreaks. And measles is a prime example of this. And we can see some examples here of outbreaks across the country that are related to high percentages of kids who are unimmunized in those communities. And one of the things that's so impressive about this is the amount of money that some of these outbreaks cost. The New York outbreak, where there's almost 650 cases of measles, cost the state of New York $8.4 million. You probably heard about the outbreak in Samoa, where there were 5,700 cases of measles and 83 deaths in 2019. And again, the common factors in these outbreaks: under vaccination, isolated communities, and religious and personal exemptions. We know that vaccine hesitancy is one of the top 10 threats to global health. And we know that many countries around the world are worse off and have more vaccine hesitancy than we do. And it was very worrisome to see last fall that 50% of Americans said that they would refuse a COVID-19 vaccine, despite the fact of how many people this disease has killed so far. Pandemics and vaccine hesitancy and vaccination delays that we've seen lead to longer pandemics and other diseases. And we may very well see increases in the number of other vaccine preventable diseases as our immunization rates stay low. We know that measles and rubella are common in developing countries. And in South America and Central America, during 2020, there were more than 3,400 cases of measles. Those folks are knocking on our door, trying to get in. And so one of the concerns that we have is we want to make sure kids who are behind in their immunizations are caught up, because we are only a plane ride away for where some of these diseases are taking place now in widespread terms. Again, this is a map that shows international airline routes, and we're all looking forward to the day when the pandemic will end and people can travel again. But we also know that is going to put us a plane ride away from where these illnesses are more common than they are here. So we've got to keep our immunizations up to date. Just a couple of things about the COVID-19 vaccines. How does the mRNA vaccine work? We know that this virus has a spike on it that allows the virus to attach to cells and enter the cells. The bioengineers have been able to take the gene that causes that spike protein to develop, and the messenger RNA that gives the recipe for that vaccine. They've coated it in nanoparticles of lipid material so it can get into the cell. That's what the vaccine is made up of. So they give the shot, the nanoparticles of lipid attach to the cell, allow the mRNA to get in. The mRNA gives the cell instructions on how to make the spike protein. So the spike protein comes out, our immune system turns on, it develops antibodies to this. That's basically how the vaccine works. We know that children can get a COVID disease. We know they can spread it. We know that they can be symptomatic or asymptomatic. We know that they can get sick from this disease and sometimes terribly ill. We know that they can develop severe disease that has led to bad lung disease, underlying heart disease. We know that kids with underlying conditions like cancer are at higher risk. Kids who are obese have higher risk for bad disease. And there's this thing called multi-system inflammatory syndrome in children, which is a multitude of symptoms and can lead specifically to heart and other blood vessel diseases. We know that kids have died from COVID. Fortunately, there haven't been too many children who have died so far, but we would like to see this, not one more child die from this. COVID vaccine for children hopefully will be coming. The vaccine wasn't tested in children during development, but there are programs that are rolling out now to start trials in children, and hopefully by later in the spring or early in the summer, we will have more data on that, and hopefully we will be able to use this vaccine in kids. One of the important questions to answer is how will kids react as far as side effects to the vaccine? We know that young adults tend to react more strongly than elderly adults. And since kids have a good, vigorous immune system, we want to make sure that kids will not have exaggerated or hyperimmune responses to the vaccine. We don't know whether kids will do well with 2 doses or whether they might need only 1 or whether they might need more than that. And we might find out that it works differently for children or better for children than it does for adults. These are all things that have to be studied before we know the answers. Some things in general to know about vaccines. Reactions to vaccines are normal, particularly with the COVID vaccines. You can see soreness, experience fatigue, malaise, headaches, fevers. We know that reactions are usually a good indication that your immune system is really working. Again, the COVID-19 vaccines are not live COVID viruses. They do not change your DNA. There's no evidence that they can affect fertility. There's no evidence that they can cause long-term effects on healthcare. And again, that information is going to continue to be collected and monitored as time goes on. You can't get COVID or COVID-19 or the flu from the vaccine because there is no live virus in it. And I hate to even think that we have to say this, but some people are saying, gee, there are microchips in the vaccine and tracking devices. The needles that are used to administer these vaccines are so tiny, nothing can possibly get through there as far as a microchip or a tracking device. There is a compensation program that the federal government has put up if people turn out to have a long-term injury from this vaccine. And again, in the vaccine, there are no preservatives, no adjuvants, no fetal cells, and no eggs. The vaccine development timeline for the usual vaccine to be developed, again, can be 10 to 15 years. But because the government has poured this money and allowed the phase 1 and phase 2 and phase 3 and manufacturing all to be done at the same time, this timeline has been dramatically compressed. No safety milestones have been skipped in the development of these vaccines. This is from the Johns Hopkins tote board about COVID vaccine worldwide. And as of this morning, 26 million cases in the US and almost 450,000 people who have died in the US from this disease. It's an impressive disease. It's much worse than the regular flu. And it's a disease that we really need to have this vaccine rolled out to as many people as possible so we can prevent many more deaths from happening. I'm going to leave you with a list of references, and I hope you'll be able to get a copy of these slides, and anything that has an underline on it is a reference that you can look at in the slides and take you right to the reference where you can find more information about vaccines. There are several good YouTube videos, and if you go to YouTube and just put how mRNA vaccines work, you can get several good instructional videos if you want more information about this. That runs me through my slides, and I'd be happy to turn the mic back over to Cynthia.
Terrific. Thank you so much, Rick, for a wonderful presentation. Also thanks for the work you do to keep our community safe from vaccine preventable diseases. So thanks so much. And I'm going to now turn over to David Martin. As I mentioned earlier, David Martin is Chief Executive Officer of Massachusetts Health Council. So thanks so much and welcome, David.
Thank you, Cynthia, and thank you, Dr. Moriarty, for that great presentation. I'm David Martin. I run the Massachusetts Health Council, and I'll tell you a little bit about the Mass Health Council before I launch into the rest of my presentation. Amazingly, the Massachusetts Health Council was founded about 100 years ago in 1920, partially in response to a pandemic that had broken out then around tuberculosis. And so the Health Council pulled together, its original members were the Massachusetts Red Cross, the Department of Public Health, the Massachusetts Medical Society, very notably, but also nursing associations and the Dental Society at the time. All these entities came together to talk about tuberculosis and set up treatment facilities and to teach people about preventative care in regard to tuberculosis. And they maintained this sort of loose affiliation until the 50s, also, working on projects similar to that, fluoride in water, and teaching public health in schools and things like that, that give people who live in communities the ability to lead healthier lives. That's really what the Massachusetts Health Council is about. It's the ability to lead a healthy and thriving life. So here today, we find ourselves in the midst of this terrible pandemic. And the first thing I really want to talk about is part of what this pandemic has revealed about a lot of the inequities and disparities in health that we see. And one really stark way you see that is in the way it has impacted Black people and African Americans throughout the country, but even here in Massachusetts. We've lost, as this slide indicates, over 58,000 lives. And this slide that number is probably a month old at this point. And this is due to longstanding inequality and challenges in Black communities and Latinx communities. So this pandemic has revealed all this, and we really need to work together to address that. And that's a big part of what the Massachusetts Health Council does. So what are some of the reasons that you see some of these inequities? Well, obviously there's a history of racism and discrimination against Black people in this country. There are specific instances like the Tuskegee syphilis study, where and many people are probably aware of this, but many people are not, unfortunately. Black men were intentionally infected with syphilis and then not given a treatment, and that is in order to see what the disease, how the disease would run its course. And that, that went on until the 70s. So things like that have given many people in Black and brown communities reason to be mistrustful of the medical system. And so that's why you see in some cases, vaccine hesitancy rates are higher in Black and brown communities for just that reason. What that really brings us back to, though, are the social determinants of health, what we are often called the social determinants of health. And that is your ability to lead a healthy life and be a healthy person is really determined by the things in your community, this social and community context, and things like your education level, your economic stability, the neighborhood you live in. Pretty clearly, if you have a high income and you live in a safe neighborhood, you're able to take care of yourself in ways that lead to better health outcomes. And what that means is when a pandemic like this comes along, you're better able to protect yourself from it, from some very simple, straightforward things that are all common sense to us. If you work in a low-paying service industry job and you have to work 2 different jobs, you're not able to socially isolate yourself the way a lot of other folks are. So we need to be conscious of these things and be ready to fix them as a society. I think Dr. Moriarty did a great job talking about how vaccines work with a lot of detail. I'm not a clinician, so you should listen to what Dr. Moriarty is telling you. You should also, of course, consult your own physician or your own healthcare professionals, nurses and doctors about these things. But just at a very high level, how vaccines work. We have white blood cells, and there are macrophages that swallow dying cells, B cells that produce antibodies, and T cells that attack cells that have already been infected by invaders and become memory cells that remember the invader. So vaccines mimic that ability to build an immunity without causing the illness. Vaccines are one of the most significant public health and medical accomplishments in the history of medicine, and from when they were first developed with smallpox vaccines, the rabies vaccine, the first working flu vaccine. Massachusetts was one of the first states to mandate vaccinations for school children in 1855. And it's accomplished amazing things, the eradication of smallpox. So you can see the success. And again, Dr. Moriarty went over a lot of this. He also went into a lot of detail around the vaccine development, so I won't go through that again. So right now, and as of just a few days ago, we also have the Johnson & Johnson vaccine on the list, and I've actually reached out to them. An advantage of being the health council is I have relationships with a lot of these existing entities, whether they're health plans or hospitals or pharma companies. So we have a relationship with them and can talk to them directly about getting us this good information. So the Pfizer-BioNTech vaccine is an mRNA vaccine, as is the Moderna, whereas the Oxford and AstraZeneca vaccine is a more sort of old-fashioned viral vector vaccine, where it uses a common cold in order to get the coronavirus's spike protein into your body so your immune system can learn to fight against it. I have a whole list here of FAQs about the COVID-19 vaccines. I won't go through all of that, but at the end, there might be a lot of different questions. Here's the part that I really wanted to get to, which is to talk about some of the very specific things that we can do in response to this pandemic to enable people to lead healthier lives. So among the things that the Massachusetts Health Council does is we sponsor student health clubs. That is, lots and lots of high schools have some kind of a student health club already, but many, many don't. And we can do a lot to help populate and resource student health clubs. So if in your school system, go back to your school and find out if they have a student health club. This is just a group of students, maybe with a faculty advisor who might be a health teacher at the school or in the school nurse department, or just a parent who wants to help out. Kids come together. We have a whole packet of information that we can give them about how to start the club, lesson plans. One great model for this is to have high school kids learn about a particular topic. So for instance, they might learn about vaping, how vaping harms the body, why you shouldn't vape. And then these high school kids can go and give a presentation to their middle school peers, right? Because the younger kids will look up to the older kids. If they hear them talking about it, it'll encourage them to stay away from things like that. And all the other different health topics you could talk about, whether it's chronic diseases like obesity and diabetes and hypertension, and what they're caused by, all things we want kids to learn about now. Very importantly, I want kids to learn about things like the social determinants of health at this point in their life, early in their life. Learn how poverty and race and where you live impacts your health status, so that we can all work together going forward to try to fix a lot of these things. And then another piece of this is the Massachusetts Health Council is actually pulling people together to serve as vaccine champions or vaccine advocates. People who live in your community, who are in most cases have a healthcare background. And again, maybe it's the health teacher or the school nurse, since we're talking about in school environments in this case. We have all sorts of resources to provide to people so that they can answer questions in their community and they can be advocates in their community for vaccines, not just the COVID-19 vaccine, but vaccines in general, but keyly and importantly right now, the COVID-19 vaccine. So that comes to the end of my presentation. I hope folks will reach out about the student health clubs or to be vaccine champions. I think those are two great programs that at this time when we're facing a pandemic like this, that's what we want to do is use this opportunity to build the structures that will allow us to get out of a pandemic like this in the future. So thanks very much. And we'll all stick around for questions. Cynthia, you're muted.
Cynthia, you're muted.
Thanks so much, David, for letting me know I'm muted, and also for that wonderful presentation. And your comments about how community members can really help to increase confidence in their own communities is really important point. So thanks so much. So I'm going to turn it over to Stephanie and Madison now. And here's our contact information in case people want to reach out to us after the webinar.
So we did have a few questions, and the first question we had was asking, could you please kindly elaborate on antigens, what they are, and why it's better there are fewer now than in 1980?
Sure, I'd be happy to take that question. Can you hear me okay now?
Yes,
Yep.
we can.
Okay, antigens are proteins, and these proteins help your body to stimulate a reaction that will protect you from various diseases. The major reason why there are fewer antigens in vaccines now is because people have been able to refine the vaccines. The vaccine that I got for diphtheria, whooping cough, and tetanus contained whole dead bacteria. Since that time, in the mid-1980s, they developed a vaccine that had very specific components of that bacteria that would stimulate the immunity instead of the whole bacteria. There used to be a lot of reactions to that vaccines. High fevers were common. A lot of local reactions were common. Some kids had febrile seizures from that vaccine. And with the new component vaccine for TP called DTAP, there are many, many fewer reactions with immunity that should be just as good.
Thanks so much, Dr. Moriarty. Another question was asked, what are the criteria for determining if benefits outweigh risks?
Well, I think, first of all, you have to look at what the disease is. For instance, polio caused thousands of kids to be paralyzed and thousands of kids to die. So that's a significant risk. They knew that the side effects from the vaccine were limited really basically to local reactions and not much of anything else. So the risks of that vaccine were well outweighed by the benefits. And that kind of discussion is going through with every vaccine that's added to the schedule. And in order to answer that, you really have to study the vaccine and know what the side effects are. For the COVID vaccines, we know that 450,000 people have died from this disease. We know that the reactions that have been reported in literally, I think it's some 20 million people who have gotten the vaccine at this point, the local reactions, fever, local swelling, local tenderness. Some people have had some muscle aches and pains. That's much better than the chance of dying or the chance of ending up in the hospital. And one of the things that we're also seeing about COVID is that many people are now being reported to have what's called long COVID, where the symptoms go on for months after the acute disease gets over. So people are fatigued, they have brain fog, some of them have found to have long-term heart or lung issues. Those are side effects from the disease. And so we are getting more and more information on a daily basis that the risks of the disease are more than the risks of the vaccine.
Awesome. Thank you so much.
So the next question is, can you explain the difference between the FDA licensing versus FDA emergency use authorization?
Yes.
Has any other vaccine in history been administered under this emergency use authorization?
To my knowledge, these are the first vaccines that have been approved under emergency use authorization. And the major reason for doing this is because of how many people have died and gotten terribly sick from COVID, and how overwhelmed our hospital systems across the country have been because of the scope of this pandemic. The difference is that with licensure, normally for a vaccine to be licensed, the FDA has to have at least, I believe it's 4 months of data to look at side effects. When the FDA looked at these vaccines, they had only 2 months of data for side effects. So it was cutting the process short, but the concern was how many people are dying in this time period, how many people are being infected, how many people are being hospitalized, which is part of why it was approved on an emergency authorization use. So does that answer the question?
I think that's great. Thank you. We have another question here that is asking, has there been any consideration to elevate the COVID vaccine to target the communities that have been most affected by COVID? For example, direct COVID vaccine locations aimed at those specific zip codes where COVID has been so hard hit.
This is what should be happening. And I think that question would be better directed to the authorities who are making decisions about where the vaccine are and how the vaccine is distributed. We know that that COVID has had major social inequities. And we know that there are certain communities where healthcare is not as available, where crowding is more likely, those areas should be being targeted. And unfortunately, we're hearing stories in the paper of how people are sneaking in front of the line to get the vaccine. And this is a problem that really does need to be addressed systemically, that the vaccine really does need to be rolled out more to the communities who are being most affected by the disease.
Yeah, and just to build on that, what Dr. Marietta said, yeah, a lot of people have been very disappointed with the way the rollout has happened. I know the Baker administration, did spoke to this the other day and talked about how they had prioritized healthcare workers, and that that led to the slower rollout into communities of color or more vulnerable communities. These are hard choices. We're going to make mistakes in these things. One thing I think a lot of this reveals is we didn't have as good a plan as we thought we did. I think there was a sense that we would be able to handle something like this. And one thing certainly my organization will do is take this opportunity over the next year or two to really think about, what would a good pandemic response plan look like, because this will happen again.
Yes, it will.
Awesome. Thank you both for that. And the person who asked the question said thank you, and they agree. So thanks so much. Our next question says, which vaccines are free? And are they all free for kids, even if you don't have insurance?
Okay. We are fortunate to live in one of the states for childhood immunizations that's called a universal state. And Massachusetts provides every vaccine that is licensed and recommended for kids through age 18. Other states provide some of the vaccines that Massachusetts provides. If you don't have if you have insurance, your insurance is required by state law to provide those vaccines. If you don't have insurance, you should be eligible for the Vaccines for Children program, which will provide all of these vaccines also. So Massachusetts is very fortunate, and that's one of the major reasons why our immunization rates are as good as they are. I've been working through the American Academy of Pediatrics with several other states who are not universal states, and their immunization rates are not anywhere near as good as Massachusetts because we do such a good job of providing vaccines for kids.
Great. Thank you.
Fabulous. Thank you very much. Can you tell us if there are any discrepancies in efficacy between the Pfizer, Moderna, and other versions of the COVID vaccine?
Well, I can speak to the Pfizer and Moderna vaccines because those are the ones that have really put their data out there and had it examined by the FDA and the Advisory Committee on Immunization Practices. And they are very, very similar, virtually indistinguishable, I would think. And when I went to get my first dose of the COVID vaccine the other day, I wasn't sure which company was going to be giving it. And I would have been very happy to take either of the vaccines because they seem to be very, very similar in their efficacy. The Pfizer vaccine is a little more difficult to work with because it has to be kept at such a cold temperature, which makes it harder to distribute in smaller lots to outlying areas. But people are finding ways to do that. We are probably going to be seeing other vaccines for COVID come along fairly shortly. And I think, again, the data for those will tell us how they compare.
Great. Thank you. All right. Our next question is lengthy, so here we go. The process, I just don't want to say it wrong, so bear with me.
Okay.
Process to get the vaccine seems very cumbersome for many elderly members and younger as well, especially those with cultural and language barriers. Who are not able to navigate the process, do not have technology literacy, do not trust the places assigned to receive the vaccine, or are able to travel to get the vaccine. What do you see as the challenge with this, and how can we help?
Well,
go ahead, David.
I could speak to this a little because on our website on protectedtogether.org, we have a spot where you can ask questions, and we have gotten multiple questions from just in the last few days. We have gotten a lot of questions from, in many cases, people who are, one example, a woman who said, I'm 78, my husband is 81, our laptop doesn't work very well. We haven't been able to get online and make an appointment, can you help? And back to my earlier point about getting vaccine champions out in the community, what we'll do, we didn't anticipate this, even 3 weeks ago, we didn't think to ourselves, well, one thing these vaccine champions can do is actually in their own communities, right, connect with elderly or homebound people and help them navigate the website. But it turns out that's exactly what our vaccine champions can do. So we've tried to connect them. That's a lot. And I don't want to overpromise on that, because if we get, hundreds and hundreds of requests for help, I can't guarantee that I have that many people who volunteered. But I also know the state is pulling together a call center, which hopefully will be more responsive to this. But to answer your question, Deborah, very directly, if you want to help with that, feel free to go to our website and sign up to be a vaccine champion, or community health educator, as sometimes we more broadly refer to it, since you can talk about not just the vaccine, but also remind people about masks and hand washing and the other things they need, social distancing, the other things we need to do to get out of this pandemic.
In general, across the country, we need a better public health infrastructure than we have right now. Massachusetts Department of Public Health is superb, but they were handcuffed in that they had no idea how many doses they were going to get of vaccine and when. And I think there wasn't enough granular planning down to, again, how is this going to be distributed in communities of special need? Again, one of the problems that handcuffed us was that the Pfizer vaccine did have these very stringent requirements for storage. And if the vaccine isn't stored properly, it doesn't work. So I think as some of the other vaccines, which have much less in the way of stringent storage requirements, come along, we will see it much easier for somebody to almost literally put a backpack on their back of vaccines and go around and immunize neighborhoods, like is done in many developing parts of the world.
Awesome. Thank you.
Excellent. The next question we have is, with the COVID vaccines available now, do you foresee that the FDA will change the emergency authorization to licensing?
I would expect so, because I think it's going to be a while before this pandemic totally goes away. And what the FDA will need is, again, more experience with side effects for a longer duration. And they will need to have the drug companies go through a licensure application, which sometimes in itself takes months to do. But I think it's in the interest of the companies to do this. And I would hope and expect that they will go through that.
Great. We have another question. So I think you went into a little bit of detail about women who, want to become pregnant or are currently pregnant. But what else can you provide any more details about women who are in these childbearing ages and what they can expect with this new vaccine?
Yes, and let me see here if I can, I can bring up a slide. This is a question that has come up. And I'll say first off that the vaccine has not been tested in pregnant women. But we know that the disease, COVID-19, can cause more severe disease in women who are pregnant. And there have been, I think, a couple of newborns who have been found to be infected right around the time of delivery. We know that any time a vaccine is tested in women, that there are some women who might get the vaccine inadvertently, not knowing that they were pregnant, or got pregnant shortly after they had the vaccine. And so the women who have been enrolled in the studies for COVID-19 are being followed. So far, no fetal abnormalities have been found in babies whose mothers were vaccinated. Historically, vaccines have not caused problems for women that the disease doesn't cause. And so if the disease doesn't cause fetal malformations, there shouldn't be any problem with it. This vaccine, again, has so far not shown to cause any fetal malformations. And there's no indication that these vaccines will cause harm to a pregnant woman. So far, that has not been reported either. The recommendations right now, and I have a link that you can look at, it's the recommendation that's been put out by the American College of Obstetrics and Gynecology. And basically they say, talk to your doctor. What are your risks? Who is in your bubble? How much exposure do you have when you're pregnant? If you have a lot of exposure, you may want to think about getting the vaccine. If you have virtually no exposure to anybody else, then you may elect not to get the vaccine. But because there haven't been so far any problems with the vaccine reported in pregnant women, many OBs are saying, think about taking the vaccine. But again, you can read the arguments pro and con in this report, and it's something that you and your doctor want to make decisions about.
Awesome, that's very helpful. Thank you.
We have another question asking us about the data on the variants. Will they impact this vaccine? Will booster shots, for example, be required sooner than later?
Oh, I wish I knew the answer to that. I don't know. And I think in part these variants have come up since the studies were done. I'm sure that there are studies going on right now where people are looking at those who are infected with some of these mutations of the virus to see whether the vaccine has been helpful for them or not. I think we will see more information about that coming as time goes on, and I'm not sure I can answer any better than that at this point.
Great.
Based on that question, we have a follow-up to that asking, with the immunity situation, we have heard reports on the news that they're looking at if you had COVID, you have an immunity of 3 to 6 months. And how does that maybe affect your vaccine situation? Can you answer any of those questions?
Yes. We don't know for sure how long the immunity lasts. Remember, this disease, we've only known about this disease for a year. We've only had the vaccines. I think some of the vaccine trials started in the spring. So we don't have that much time to determine how long immunity lasts from the disease or how long immunity lasts from the vaccine. There was something in the news this morning. Let's see here. Sorry here. People who have had COVID disease may have a more vigorous reaction to the first dose of the vaccine, and perhaps they will need only one dose of the vaccine. So again, this is a very preliminary piece of information. I don't know that anything other than slight comments have been published about this yet. But we also, again, we're just in the process of learning about this disease, and we need more data on the long-term information about immunity from the disease and from the vaccine.
Great. And I think we have one final question, and this will be directed to both David and Rick. So what do we do as far as advocacy on this topic, especially COVID-19? Is there any hints or advice you can give us as, citizens and volunteers and community members in the nation?
Talk it up. Talk to people about what they're thinking, what they're reading, how they're feeling. We know that that the pandemic has caused a drop in immunization rates for many other diseases too. And we know that when there is a drop in immunization rates, we're a setup for disease outbreaks. So really urge folks to keep up to date with their immunizations and to talk to their healthcare professionals rather than getting information from Google or Facebook or Twitter about these vaccines. There's a lot of unfortunately bad information that's out online, and you want to get your information from reliable sources. The last slide on my presentation is a list of good websites to go to for accurate information, and I think it's important to share those. The other thing is, as time goes on too, look at the Massachusetts school immunization rates for where your kids are in school. Share that information with people. And if you're seeing that the measles immunization rates are low or some other immunization rates are low, it may be something that's worth thinking about and bringing up at a PTA meeting to say, what can we do to help get immunization rates up to the point where they should be?
Yeah, and I would add to that, go to our webpage, protectedtogether.org. We have that information there. First, I love the question. I love that you're thinking, how can I help? How can we use this opportunity to build something better?
I don't remember a huge amount from when I was 6 years old, but I do remember in the look in my parents' eyes when I would ask to go swimming at age 6 during the midst of a polio outbreak, and they were fearful. They almost didn't want us to go out of the house at that point. And I remember that there was a little girl in my kindergarten class who, for some reason, I remember that her name was Sandy, and she was out of school for a while and came back on crutches because she had gotten polio. We have tools to prevent these diseases, and it's looking for all the world like we have tools to stop this pandemic if people will read about it, understand it, get good information, and get immunized.
Okay, it appears as though we have gone through all of the questions and answers. At this time, I'm going to ask everybody, that is including Madison and including Stephanie, to come in so that our participants can also see all of us. First of all, I have to tell you, thank you to our participants for being really so into this. I can see everything in the back, all the Q&As and the chats going on. This has been absolutely terrific and very informative. It is really apparently clear that we must be knowledgeable, we must be informed, we must be diligent, so that we know we have the necessary immunizations and vaccines to keep us both individually and collectively healthy. To Dr. Moriarty and to David, and I don't see David. David, I don't know where you went, but both of you, thank you for a fabulous, informative webinar. Cynthia, we cannot thank you enough for all that you have done to help us with this webinar. Cynthia, David, and Dr. Moriarty, PTA, Mass PTA members, and David and Cynthia, and we're going to get Dr. Moriarty also to be on the health committee. I really want to again thank all of the attendees. I really want to thank Cynthia and Madison and Stephanie for being the technology people in the back, as well as Cynthia being the moderator. You did an excellent, excellent job. I'm so pleased with all of this. Before you sign off though, as a reminder, I want you to make sure that you see the poll, the survey poll. please take a minute to fill that out, because your feedback, your thoughts really give to us what we need to further this program of Mass PTA health, safety, and wellness. I want you to know that this is the second part of a 3-part series. So please let us know what you're looking for. Our next webinar is being brought to us on March 3rd. Here's a banner for this, and it's from Minding Your Mind, and it's called Supporting Youth Fears, Worries, and Grief, a webinar for adults. We really hope that you will join us, because there has been, my background is all in education, in counseling and psychology. There has been an exorbitant amount of young people, children, early adolescents, late adolescents who are being extremely troubled by this pandemic. And they're feeling isolated, they're feeling a great deal of fear. And hopefully, we know Linda Price, she will provide for us a webinar that is second to none. So I invite all of you back, and feel free to bring a friend along with you. So at this time, Cynthia, would you just explain one more time about the poll that's about to come out?
Sure, and thanks, Jackie, and thanks again for supporting the Mass chapter, the Immunization Initiative, and our efforts to ensure that Massachusetts citizens are really vaccinated against vaccine preventable diseases. So thank you so much. When we conclude the webinar, if people will just stay on the browser for just a moment, they will get a pop-up with the webinar evaluation. If they could take a few minutes to respond to the questions in the evaluation, it will help the committee for planning future webinars. Participants at tonight's webinar also will get a reminder tomorrow with the email link. So if they don't get it tonight, they will get it tomorrow. But if they just sit tight after we close the webinar, it should pop up on the browser.
And one last piece that so many of you have asked in the chat and in the Q&A, this will be available on our Massachusetts PTA website. If you click into that and then go into the Health, Safety, and Wellness Committee, and then you slide into the health webinars. I want to give a huge shout out to Stephanie Gray, because everything else that she does, she is our webmaster, and she also chairs the little group of communications people. She is a remarkable person, along with our president, Madison Estes. I am so proud of Mass PTA and all that everybody does. Thank you so very much. If you are not a member and would like to become a member, by all means, please do. Is it over, Cynthia?